Hey there! If you're joining us for the first time, maybe you're wondering what SIHI is and what SIHI Talks is all about. We are the Social Innovation and Health Initiative, SIHI for short, pronounced as SIHI, which means upward and forward looking. SIHI is a global network of passionate individuals and institutions who dream of a healthier and more equitable world through social innovation. Since 2014, we have been advancing social innovation in health through research, capacity building, and advocacy. We currently have 13 country research hubs in Africa, Asia, Latin America, and the Caribbean, and Europe. SIHI Talks is a series of monthly webinars that we hold to provide a platform for potential and current partners to connect and find opportunities to collaborate. Welcome! We're glad that you could join another conversation on social innovation today.
Yes, welcome everybody. So thank you for joining us here on Zoom, as well as those who are watching through Facebook and YouTube. So my name is Julia. I'm from the SIHI Secretariat, and I will be moderating today's SIHI Talks. So today's session features the Social Innovation Learning Competencies Project to share research findings and key lessons. And in a while, we'll give more context on the project and introduce the speakers. But first, for some house rules, to keep the program simple, we will keep cameras and microphones off for the audience. But you may use the chat box to introduce yourselves, share comments, and questions as we go along. So after the presentations, there will be a Q&A portion. So we can read your questions on the chat, or if you would like to share something lengthier, you can use the raise hand function and I will unmute you by then. So it will also be a good opportunity for networking and sharing ideas for collaboration. So this session is being recorded and live streamed, and you can revisit it anytime after we end the program. So let's get the ball rolling. So to begin, may I call on Dr. Michael Mihut, Head of TDR's Program Innovation and Management Unit, for a opening message.
Hello, good afternoon, good evening to everyone joining, and good morning in the Americas. It's a pleasure being here today, and thank you for organizing this SIHI talk specifically. The topic is very important as TDR is supporting the drive to mainstream social innovation in countries and social innovation research, capacity strengthening, and advocacy work streams. And for this, as you know, social innovation is a relatively new field. We need to map what is out there, and we need to understand what skills and knowledge and learning is necessary for people to be most effective when conducting research in social innovation. For this, we thank a lot our hubs and secretariat who contributed to developing this area of learning competencies, and we are very eager to learn from it and to see how we can apply this in all other TDR projects. Thank you very much.
Thank you very much, Dr. Michael. It's always a pleasure to have you here at SIHI Talks, and thank you very much for the support from TDR. And now I pass on the mic to Dr. Joe Tucker to take us through the topic of today's session and introduce our speakers. So he leads the SIHI Fellowship Program and is one of our esteemed research mentors at SIHI. So Dr. Joe, take it away.
Thank you. Thanks everyone for joining us today. Today, the topic is what should we be learning about social innovation and health, and a group of SIHI fellows and early career researchers came together to do a series of sort of activities, and they put together a couple of presentations, and I'm not gonna have any sort of longer intro. The first presentation is about core competencies for social innovation and health training, evidence from a global scoping review and crowdsourcing open call. And so Zishuan Zhu from our SESH team and Dr. Ogachukwu Aribador, both of them are SIHI fellows, and they're going to tag team and tell us more about the scoping review part of this and the open call. So over to you, Zishuan and Oge.
Greetings, everyone. Where you're coming from. Thank you, Joe, for the introduction. We're happy to have you today in the first SIHI talk in 2025. So this is a SIHI fellow collaboration, and we try to look at the core competencies for social intervention in health training, evidence from global scoping review, and crowdsourcing open call. And this is in collaboration. We did that as a part of our social intervention in health learning competencies project, as earlier mentioned by Joe. It's me, Dr. Gechukwu Aribodo, speaking from Nigeria, and Zishan Zhu from China. Next slide, please. On behalf of the SIHI fellow team. Thank you. Next slide, please. So this is the outline. We're looking at the study background, the objectives, the methodology, and finally the results. Next, please. Why is social intervention in health important? Social intervention is a community-engaged process that helps to address local health and social challenges. And in so doing, it combines innovative and inclusive solutions to help to improve health outcomes. This helps to bridge health improvement and make sure that social change is sustained and it is done through efficient approaches. By focusing on ground-up participatory methods, it helps to empower communities. Next slide. So when we carried out our first SIHI Fellows workshop, we identified some certain challenges within the low and medium income countries and found out that there is a need for social intervention in health training to take place. And these challenges included health inequities in low and medium income countries, as well as resource constraints in healthcare systems. And above all, we saw that there were minimal LMSC specific training frameworks available. So that is why social intervention is important to LMICs, because it will help us to deliver context-specific solutions to health inequities. In that same way, it will help us to build local capacity by leveraging on knowledge and resources. At the same time, it will help to promote equitable, sustainable health interventions. So the reason why we focus on training for core competencies is basically to make sure that the social innovators are equipped with the relevant skills, mindset, and knowledge to help them to tackle complex health challenges, as well as address gaps that we've identified through our training during our workshop earlier on, where we notice that high-income countries, the training frameworks revolves around what they do in high-income countries. Above all, we intend to establish a standardized evidence-based framework for inclusive social innovation in health learning. So for more reference, for this objective, this made us to have two main objectives, and it included to identify core learning competencies related to social innovation. We want to identify the core learning competencies that are related to social innovation in health using scoping review and crowdsourcing approach, as well as to develop a consensus statement on learning social innovation in health. We did this in 4 stages. We started first with scoping review, led by me, followed by crowdsourcing by open call, led by Jishan Ju, who is my partner here, as well as we went ahead to carry out social intervention mid-year training workshop. This was led by Yushua this last year, and we ended up with Delphi consensus building, and this was led by Emily. We are all SIHI fellows. Next slide, please. So now to scoping review. So a brief overview of what we did. We followed the Prisma extension and JBI methodology for scoping review to ensure that there's transparency and methodological rigor and credibility is carried out. Thereafter, we tried to develop also a protocol, and we standardized it and uploaded it in open science framework for transparency. For the eligibility criteria for the scoping review, before we commence, eligibility criteria we included studies that on learning or teaching of social intervention in health and frameworks, as well as educational methods in social intervention in health. All study designs and publication dates were considered. Articles that did not meet our inclusion criteria were not published in English or had no full text available for screening were excluded. Next slide. So for the search strategy, we conducted systematic search which commenced on August 14, 2023 across 9 databases, PubMed, Scopus, ERICS, and with the help of a librarian. We started first with 2,165 records. and screened about 1,673 incompetents. Additional searches, of course, were carried out to ensure that we didn't leave any data behind because we are searching for evidence. So we cite SIHI website, European Social Innovation Database, and Google Scholar. Search strategy focused on social innovation, education, and health. Next slide. So for the competence, before we started data extraction, we pilot tested the competence platform by 2 researchers, and then discrepancies were resolved by a 3rd reviewer. Thereafter, we developed a standardized form and used it to extract our data for study characteristics, which included the author, the setting, the purpose, the learners, etc., as well as the training strategies, outcomes, and social intervention in health competencies. For the recurring themes that form the basis of class, we found out there were recurring themes, and this helped us to form the basis for the competency classifications. So we grouped the competencies into skills, mindsets, and knowledge, focusing on social innovation training practices. Next slide. From the results of scoping review, we were able to analyze 20 studies at the end of the day, and most of them were from high-income countries, with 10 from high-income countries, 7 from medium-income countries, and 3 from LISCs. All the studies, all the articles we reviewed were published between 2007 and 2022. And then they have common settings, with universities having the highest number of studies being carried there. They had learners, including students, researchers, and healthcare providers. However, the duration of training and teaching activities varied, and it ranged from 2 days to 4 years. Approaches were also varied, but we saw that team-based learning was the highest, followed by participatory methods. The findings of the scoping review directly informed the structure of our crowdsourcing open call. So, Zishwan, over to you.
Hi everyone. Thanks, Og, for your fabulous presentation on the scoping review. As you've mentioned, we started from the scoping review and then moved to the crowdsourcing open call. So the scoping review results actually suggested that a bunch of literature that we discovered in the database was basically from the high-income country setting that was conducted in higher educational, like universities or nurse school, etc. So we're looking forward to an approach that can engage the local communities and local activities that was actually conducted among the low and middle income countries. So that comes our crowdsourcing open call. For those who are not that familiar with the crowdsourcing open call, so this is a community engaged process. Crowdsourcing for health challenges allows a group to solve a problem. Usually it's like local health challenge or is dedicated to a specific community, and solutions are then shared with the public. It explicitly focuses on generate public benefits. As the graph has suggested on the right place, it starts with select a crowdsourcing method and then organize a community steering committee. Then it continued to engage the community to contribute and come up with the ideas that might be the solutions to best address this certain topic. The committee will receive and evaluate the contributions and then recognize the finalists. For those have been selected, the finalists' idea will be shared back to the community and the solutions will be implemented. So our crowdsourcing open call basically followed this recommended procedure by the WHO and TDR. We hold this crowdsourcing open call from 2023 February till the April. During this open call, there are 4 categories that we are specifically interested in. The first is curriculum or module that designed for social innovation in health courses. The second is the lessons learned on how to adapt training practices in complex settings with limited teaching capacity. So this was especially focused on low and middle income countries. The third is about the participatory training methods, that approach that has been taken. The techniques have been applied, including the co-creation, flipped course, digitalized techniques such as games and apps. The fourth is about the way to evaluate social innovation in health. So for those who are interested in the open call, I understand that it might be, it's already over, but if you're interested in, can scan the QR code here for more information. We're glad that this open call has actually received bunches of very fabulous answers and submissions globally. So in Feb 2024, 43 submissions were received from the open call and 38 were eligible scoring. Most participants are from low and middle income countries, as you can see from the right graphs, across African, American, and Western Pacific regions. So those social demographic graphs can provide some preliminary pictures of how our participants are from. We got a quite balanced age, and we got around 40% of female participants. The most of the submissions are from middle-income country, and we got the most of the submissions from the regions of Americas and then African regions. So about the scores, entries were scored by 11 independent judges, and we have 8 finalists recognized. The finalist topic include design songs, human-centered design, intersectionality lens, behavioral design praying, co-creation living lab, and etc. As you can see, we got this average score for open call submissions. For all of the submission has been scored 7 and above. We were then invited them into the finalists. So the finalists then were invited into the co-creation, where we prepared the materials and trying to co-create a new curricula that was dedicated to the core competencies that we have identified from the open call, which Emily and Yusha will cover later. So here's the final result that we have from both scope review and evidence from the open call. We did this evidence synthesis. We got around 38 eligible submissions plus 20 scope and review literature. So by the end of the day, we have categorized 3 domains, which are the skills, mindsets, and knowledge in the social innovation in health as the core competencies that we want to pay attention to. The second column have listed those 16 competencies. We've listed by the frequency that they have presented and the evidence. So the most frequently mentioned competency is the problem solving, which is defined as the way that we frame and address local challenges. The second rank is the communication, which is helpful to engage stakeholders effectively. Followed in the skill sets, they have design thinking, entrepreneurship, and sustainable finance, leadership, monitoring, and evaluation. Also for mindsets, the most frequently mentioned mindset that was considered important in social innovation in health is the creative thinking. It's more focused on the novelty and creativity of people to address the local problems. The second part is about the collaboration and partnership mindset. This is especially focused on promoted a interdisciplinary teamwork. We also have identified social determinants, adaptability, empathy, and resilience as the core competencies that needs to be addressed or to be further trained in the social innovation in health practice. As for the knowledge, the most frequently mentioned knowledge sets is the community engaged participatory method. So we got 30 evidence that has been mentioned. They have applied this community engaged participatory method in the training and practice. And also we have the health disparity, which address the inequality in health access that leads to the key points of some of the health problem in local community. And also the intersectionality, which is also highlighted. This is usually come with the culture and gender issue that has been then intertwined with the health problem in local communities. So for more detailed explanation and cases of how those competencies being addressed, please following our later literature work that we will gonna have hopefully have a paper published on this one. then move to Og for your
So
discussion.
thank you so much, Joshua. So for a follow-up on the discussion now, so similar to the scoping review, we used we identified there was a geographical bias and limited representation of LMIC. So to mitigate that gap, we made sure that we carried out this open call, like Joshua said, and that made us to engage 89% of LMIC countries to join us in this evidence synthesis. So for the mindset, for the skills that are required, we observe that the most required skill for addressing health challenges, especially in these resource-limited settings, were problem solving and communication. And then the necessary mindset needed were collaboration and creative thinking. And this must go well because they want to address complex health scenarios. And then for the knowledge, we found out that for community engagement ensured that there's intervention that is culturally appropriate and widely accepted. And that is why social innovation is very important, in health is very important. And then finally, emphasizing on the knowledge, they emphasize more on health disparities and intersectionality, as this helps to promote equitable and inclusive health solutions. So the training programs focusing on these competencies can actually help to build capacity for impactful social intervention in health, especially in low, medium, and income countries. Thank you. Joshua, over to you on the key insights.
Yeah, thanks, Og. For the key insights that we want to take home, the first is community engagement. We have integrals for effective social innovation in health training that align with WHO guidelines, as being mentioned in this competency sets. And also it's about intersectionality. It's very interesting that how the open call submissions and the scope and review literature has highlighted this as essential knowledge for addressing healthcare inequalities and tailoring solutions to marginalized groups. And then it's about global applicability. So we've conducted a subgroup analysis across all the evidence from high income settings and low and middle income settings. And it is quite interesting that we found a similar training focus across these two different types of settings, which actually enabled us to think about a more broader adoption and leads to the idea to build this consensus to break out through all of the practice and evidence that across different settings. As for the implementations for this specific study, the first one definitely is to expand the low and middle income training and social innovation in health. We did have observed a lot of practice existed there, but when we were talking about how the training were delivered, is it like standardized, or is it like abundant resources? Definitely, we need to have more research and literature on this area in low and middle income countries. And then it's about diversify learning audience beyond higher educations. We got this scope and review literature that was basically based on a university or nursing school or healthcare settings that was already have a higher education. And it's really worth trying that we need to expanding this training to a more broader audience. So for the learning perspective, the core competencies can complement it or guide the development of later social innovation in health curricula. So thanks all for have worked in this research. Our main conclusion is to identify gaps and priorities shape the competencies framework for social innovation in health. And we also highlighted the importance of engage diverse stakeholders to co-create the meaningful solutions. We want to have this acknowledgement to the leading team of both scope and review and open co-steering. And also, we appreciate all the mentoring efforts from Elizabeth Chen and Josephine Tucker for their fabulous guidance throughout these 2 years. And we also want to address our special thanks for Dr. Michelle Mihut and Beatrice Habab for your kind support to conduct this research. Thanks. This is all of our presentation.
Thanks, Zishwan. And okay. Any quick clarifying questions before we go to our next speaker? Does anyone want to chime in? Feel free to put, if you do have questions, feel free to put them into the chat box, and we'll have some time at the end for Q&A. So our next speaker, I think Oge and Zeshwan did a really nice job of raising all of these, all of these priorities. So many things to learn. How do we prioritize them? Like, what are the important things? How do we figure out what should be on the list of like key priorities? That's going to be the subject of the next talk. Dr. Emily Wallace did this research as part of her master's at the London School of Hygiene and Tropical Medicine. She's from Ireland, and she's an innovation fellow in Ireland. And I think her position actually is really fascinating, and it's been great to have her as part of the team, and she's done a wonderful job bringing this together. So without further ado, over to you, Dr. Wallace.
Thanks for the introduction, Joe, and thanks to all at SIHI for the opportunity to present today. I'll just share my screen now. Okay, so I'm going to be presenting on GLOWs, which is Global Learning Opportunities within Social Innovation and Health. This follows on quite nicely from Oge and Zeshwan's presentation, as we used a modified Delphi process to build consensus around core competencies in social innovation. So just in terms of an overview, I'm going to discuss the background briefly first, then talk a little bit more about the modified Delphi and how we went about doing that, and then we'll discuss some of the core competencies as well as the pilot workshops, which were led by Yusha Tao, who I'm presenting on behalf of today as well. So I know that Oge and Zeshwan kind of touched on a lot of kind of an introduction or a background to social innovation, but it's a community engaged process that connects health improvement and social change by leveraging diverse strengths and unique insights of local institutions and individuals. And it really is a lens centered on community engagement and involves designing innovative solutions to tackle major health and social problems. So we know that social innovation, education and training can give local communities and health practitioners the tools to solve these health problems that they're facing. But prior to the study, there was quite limited evidence and consensus existing regarding the core competencies that should be consistently achieved from social innovation and health training. And while numerous education programs do exist, the content and methods tend to vary quite a bit, and most of them have been developed in the context of high income settings, and therefore not necessarily representing LMICs as well. So in terms of the objectives, we wanted to come to consensus on a core set of learning competencies in social innovation and health. And I'd just like to thank everyone on the call that has been involved in this. We then piloted these competencies in the workshops led by Yusha online over the summer months. And then finally, we aim to aid the development of a conceptual framework that seeks to enhance social innovation, learning and teaching. So I'm just going to chat a little bit about the consensus building process. The aim of consensus decisions is to meet a group's agreement and acceptance, and consensus building processes are quite useful in the development of conceptual frameworks and guides to ensure that a wide range of expertise and perspectives are included through stakeholder engagement and inclusivity. And this particular study on learning competencies in social innovation and health, we used a consensus decision-making process called a modified Delphi, which involves iterative surveying and teleconference sessions. And Some of you may be familiar with this through some involvement in the study. Some of you may have completed one or both of the surveys or joined some of our teleconference sessions. But just by way of refresher, we use the RAND UCLA appropriateness method, which is a form of modified Delphi. And we had 2 rounds of iterative surveying online through the platform JotForm. Round 1 statements were informed by the scoping review and the SIHI open call, which my colleagues had just discussed. And then round 2 statements were iterated based on the feedback from participants in round 1 and the teleconference sessions. In June, we held teleconference sessions online on Zoom in between administering the first and the second survey. And we repeated these sessions at 2 different times so that we could facilitate attendance in different time zones. So this slide kind of just gives an overview of the different steps of the modified Delphi component of the study, or the consensus building component. So as I mentioned, we developed the initial statements based on Szechuan and Oge's findings, and then we sent out an email inviting people to express interest in this study. So at that point, 68 people responded, 46 people then completed survey 1, which included 28 different items, and participants were asked to rank their level of agreement on a Likert scale of 1 to 9, 1 being strongly disagree and 9 being strongly agree. And they also have the opportunity to insert comments or suggest edits or additional statements. We discussed the findings of the survey in the teleconference sessions that I just mentioned, and then survey 2, 34 participants responded to the 30 iterated statements. Some of the statements from survey 1 were amended based on the feedback, and some were added as well as merged together. And then finally, we analysed the results and are now in the process of disseminating those results. So participants were recruited from the SIHI network, corresponding authors from the literature review, and other academics with a research interest in social innovation. And I won't spend too long on this because my colleagues have just kind of discussed these themes, but these were some of the findings from the literature review displayed here that informed the statement development. Both of the surveys had approximately 30 statements, as I mentioned, scale of 1 to 9, and where participants could rank their agreement, and there were boxes for comments and suggestions. We used a calculation called IPRAS, or the interpercentile range adjusted for symmetry, to demonstrate the level of agreement among participants using the Likert scale. And it's based on the entries that participants put in, and uses the interpercentile range between the 30th and 70th centile of scores, the median score, and then a correction factor for asymmetry, which ultimately gives a disagreement index, which indicates the level of group agreement. And in terms of the analysis then for the comments, we coded them into comments that were largely expressing agreement, comments that were proposing amendments, and comments that disagreed with initial statements. And these comments informed the final consensus statement. So in terms of results, we had 67% completed survey 1 and 53% completed survey 2. We had quite a diverse representation from 24 different countries, from 6 different continents, and there was a combination of high income and low and middle income respondents. You can see there just the gender breakdown. So now just moving on to results. As similarly to the open call and literature review, we categorized the core competencies into skills, mindset, and knowledge. So you can see on the wheel here examples of some of the types of core competencies. And some of the ones that came out with really strong agreement included intersectionality, which was subdivided into knowledge of health disparities, the social determinants of health, and the importance of empowering local Indigenous communities to be involved. Communication was also a really key one, which included engaging communities, pitching and storytelling. There were a couple of different competencies relating to mindset, which were also deemed to be very important by participants. Social entrepreneurship skills, which include securing funding, leveraging network and collaborations, and building a team, and community engagement were all deemed to be very important core competencies, among others. And we got some really valuable feedback from participants in terms of considering the different ways of learning. So we acknowledge that some of these core competencies could be achieved through teacher-delivered sessions, some may be self-directed learning, and some may be experiential learning through delivering social innovation. And crucially, a priority for participants was that learning resources are made open access and in several different languages. So now on behalf of USHTAU, I'm just going to chat about the pilot workshops that were run over the summer months. I'm sure many of you had attended or were involved in the creation of these workshops. There were 8 sessions over 8 weeks, and there was 12 competencies piloted. So on slide here, you can see some of the different competencies piloted in each one, and I can make my slides available after this presentation if anybody wants to look into it further. And in terms of results of the pilot workshop, so there was a post-workshop survey sent to everybody who participated. Overall, participants reported good satisfaction with the workshops. One of the quotes was that the workshop's practical tools directly enhanced a participant's projects and boosted their confidence. And most participants also reported a significant improvement in their confidence and skills, with a 1-point increase in learning competencies across 6 areas after completing the workshop. And further details are available on this analysis as well. So just in the interest of time, to conclude, we developed a consensus statement based on 2 iterative surveys and teleconference sessions using a modified Delphi, which represented participants from 24 different countries. Some of the really key competencies were intersectionality, communication, community engagement, social entrepreneurship, and mindset. And some of these were piloted in the summer workshop training, which was very positive. And then finally, we hope that the outputs of this project can support learning and social innovation in health, and are working on a peer-reviewed publication and a conceptual framework to enable this. So yeah, just some acknowledgements here. Just acknowledge and thank the rest of the research team that were involved with this. Huge thank you to anyone who participated and contributed to this, as well as SIHI for inviting us to present today, and the TDR. So yeah, I'm very happy to take any questions, and thanks again for the opportunity to present.
Thanks, Emily. That was great. Questions? I think we have a few minutes for questions. I guess I have a question for all 3 of you in terms of if you were to go to the last mile, so for Oge, like, you know, northern Nigeria, poor bandwidth, not a lot of institutional resources, what do you think are the most important parts of social innovation? Like, what are the core competencies that would be relevant there, and what are the methods and approaches that we should think about to train or partner in those communities and spread the word about social innovation?
Thanks, Joe,
You're
for the
muted.
question.
Okay, sorry.
Yes, so you're actually right. So for the question, exactly, because I had to come to a different location for this, and you can see I'm sweating. Yeah, so in our own location, what I may ask, what I would like us to develop and work, the competencies that we need down here that will be feasible to be achieved and that can lead to more results is team spirit, ability to collaborate together, and then tailor our health research needs to identify the indigenous solutions that can help people to collaborate. So collaboration is very, very important down here, as well as team spirit and as well as resilience. Because if you are not resilient in doing this, you will chicken out along the line and you will not be able to push through. So basically, we need to engage in more community engagement and see how we can get more people on board and get it stabilized here. Thank you.
Thanks. Sichuan and Emily, any other thoughts on what are things that, like, if we're training people who haven't heard about social innovation in last mile or more remote settings?
Oh, sorry, you can go first.
So, since I'm working on a pay-for project that was actually dedicated to improve STI testing in China, while we are doing this, so it's also a social innovation, just to mention. So when we are trying to apply this pay-for approach to comparatively more remote areas and southern China, we did find that the first thing that we have to start is like we have to go deep in the context about the key point that we've raised today in both presentations is about the intersectionality. That is like to what extent you understand why this would happen. It's not only about how you mobilize the local resource, but it's more about like why there's a problem that only for a certain group. So we were working to improve the test uptake among MSM group, which actually the identity and the marginalization of how this group has been considered in public health facilities would actually become a border in the very initial time. So we started to communicate and understand why this would be a problem and why we need to improve the test uptake, which I think is very helpful that we start to let the public health caregiver to understand, oh, okay, so you have to be aware that there are groups that is disproportionately more vulnerable than others, and they are in need to improve the healthcare, for example. So I want to raise this specific point, and I'm very glad that we got this evidence from both two research that intersectionality actually made up some of the key challenges in, let's say, more low and middle income settings. That people need to understand what has happened and what makes them vulnerable, and then move to the next steps. So that's my answer. Thanks.
Thanks, Sichuan. And I see Michael's hand is up. Michael, would you like to ask a question?
Sure. Thank you very much. Very interesting presentations and insightful. Thank you for the work that led to these results. I have a point. I have 2 points that are linked one to another. The first one is the fact that TDR is launching soon to get through the SIHI hub of Indonesia. And thank you so much for their work to prepare this with support from other hubs in Ghana and the Secretariat. They will launch soon the first MOOC, the massive open online course on social innovation, which has been in development by TDR and the SIHI network for 3 or 4 years already. So it's going to be the first time that we are launching it full scale, and we invite everybody to test it, sign up when the registration will be open, obviously. Please sign up and do the course and tell us how we can improve it. But also, this MOOC will contribute to some of those skills, knowledge, competencies that are in the curriculum. So maybe it would be useful to see eventually what other kinds of tools could help the future researchers, the future social innovators as well to achieve that the fullness of that curriculum. And part of that is, so my second question linked to this is, what would be the best mechanisms, or maybe we need to research that in the future, some ideas on how, because this is a more recent field, social innovation research, for mentorship. I know that you have been testing some models for mentorship, and it could be useful because if new researchers or social innovators want to join the field and take these courses, then what would be possible ways to keep them engaged through a mentorship or through a community of practice or stuff like that? Thank you very much.
Thanks, Michael. Emily, okay, Zishwan, anyone want to jump in on those?
Okay, so Michael, thank you so much for this. And I think for mentorship, I think going forward on this, I think the best thing that the person can actually focus on is how to, the best focus for, if I get your question correctly, you were asking on what is the best approach if I'm to take this as a mentorship thing. So if it's going to be that way, I think co-creation and partnership is a very important key. You need to understand their needs first. So you have to tailor it down again to context specific. You have to understand the needs of people you're about to work with. So that is the major thing. Context, this assessment is always very important. And that's the intersectionality we talked about, especially in this climate where you have gender sensitivity issues and gender bias existing very well. Thank you.
Thanks, okay.
Thanks, Michael, for.
Oh, go ahead,
sorry.
go ahead, Emily, go ahead.
No, I was just going to say it's great to see or to hear about the MOOC that's going to be launched. I think another important point to consider, I suppose, is, in terms of capacity building, teaching people and giving them the skills to innovate socially, but also giving them the skills to teach others about how to get involved in social innovation and community engagement so that they can bring it back to their communities. And that probably is somewhat linked to Joe's question as well. So yeah, great to hear that the MOOC will be launched and looking forward to seeing it.
Meredith, I see your hands up.
Yeah, thanks, Joe, and congratulations to the team. I was actually excited to listen to the results. Been following the discussion also through email. I think this is very important, especially to all the hubs, since we are all doing capacity strengthening. What caught my attention, actually, especially on the first early presentation on the results, was there was a result on entrepreneurship as part of the competency. So in the Philippines, and I think we've been doing a lot of conversations along the context of sustainability of the hubs and of course the network. So can you shed more light on this? Is because there's a lot of argument on social innovations. Should we really go with entrepreneurship, and what did the results of the study show, if you have? Thank you.
Okay, so Meredith, thank you so much. Once again, I'm on the floor if you don't mind. And thank you so much for talking about it from perspective of social innovation in innovators in health. So down here in our own context, yes, what you said about entrepreneurship and sustainability, you cannot separate it as a social innovator. And I'm happy we saw it in the review, both in the open call, scoping review aspect and the open call aspect, because it's actually a very big challenge. Most of these innovators don't get to have funders. So they need to think inwards on how best to sustain whatever project they've been doing that is nice. So that means that they have to wear their entrepreneurship thinking cap and then think of a way to have a paradigm shift from the way they do things different and learn how to do things differently. But then that's again where social innovation in health team should actually come in to help them to fine-tune their research. That's another aspect I'm looking at by seeing how, first of all, before you can become an entrepreneur very well as a social innovator, it's important that you also acquire this skill, and this skill can be taught. I like the fact that MOOC is coming up, but I wish it can be stepped down to all these rural communities. Meredith, you know that we don't get these people online. We go to remote areas to get them, and they don't understand most times the English aspect. So even while the MOOC is ongoing, it's still encouraged that you engage these entrepreneurs to learn about this physically, engage them physically by having a physical attendance and train them on it, but first, and then help them to fine-tune their work in line with what we have as SIHI activities. Thank you.
Good point, Solgi. Thanks for sharing that.
Yeah, thanks for the question, Meredith. So just a little bit on top of what Olga has already answered. On the current evidence we did see that there's a bunch of curricula that was developed from a business school or like from business perspective on how social innovation might maintain. And then, like the social innovation has become a topic in those business-led or business-oriented curriculums, but then there's like less focus on more like nurse school curricular, or like I think there's one literature about how to have more social entrepreneurship learning in nurse school to encourage the healthcare giver to those provider to understand what may be sustainable and like to sparkling social innovation in a more entrepreneurial way. In the open call submissions, we did have seen like people are trying to have this focus that emphasizes the importance of a sustainable financing to support this innovation, especially to support the training conducted in local communities. So I think another way to interpreting or to find out the more sustainable approach is like we might to have a interdisciplinary idea to, you can't always limit your curricular that was already set in the public health school. Maybe just having some interpretations across different disciplines and across different higher educational setting would also have benefits in both way that we can think about as a more collaborative solutions to involve more stakeholders to find out this different perspective in designing the curriculum. Thanks.
Thank you, Sichuan. Yeah, that there's a thin line between social entrepreneurship and the business entrepreneurship. That's always the discussion. But when we moving towards institutionalizations, that's always the question for us. But yeah, thank you for doing this study, and I think we're looking at more evidence, especially in the context of social innovations.
Any other questions? If not, I think we can wrap up a few minutes early. Thanks everyone again. Thanks Emily and Oge and Sichuan. This was really fantastic. And they have these pieces of work are in two separate manuscripts that are very close to being submitted. They should be preprints, or one's a preprint already, one will be soon. And yeah, thanks again. Thanks everyone. Have a good day.
Thank you. You too. Have a good day, everyone. Bye.
Thank you all. Have a nice
Thank
day.
you all.
Thank you.
And
Have a good
thank you to
day.
our speakers. We really look forward to the papers to be published and out.
Thanks, Olgi. Good to see you again.
Thank you, Meredith.
Congratulations.